One of the most important things to do to prepare for surgery is to have nothing to eat or drink after midnight the night before your surgery. It's very important that your stomach is empty. This is for your safety. The anesthetic medications can relax the muscles at the opening of your stomach, and if you're lying down and those muscles relax, anything that is in your stomach can come up. And the first things they hit are your lungs, and you don't want your stomach contents in your lungs. So to have your stomach empty is important for your safety. Sometimes this means you have to go for a long period of time without anything to eat or drink, and it's inconvenient and uncomfortable, but it's very important for your safety. Also, the surgical schedule can change, and we can sometimes do your surgery a little bit earlier than originally planned. If you've had something to eat or drink, we can't bring you in earlier and therefore finish your surgery and get you home earlier. Sometimes, depending on the routine medications that you take, we advise you to take some medications the morning of your surgery with a very, very small sip of water. These most often include blood pressure medications and heart medications, although there are some others that Dr. Manley and your medical doctor will determine which are best for you, and you will be advised of what those medications are. Prior to surgery, it's very important that you don't take anything that can thin your blood, things like aspirin and ibuprofen, Motrin, things that you can get over the counter for headaches and colds. These can thin your blood and cause you to bleed more after surgery, so we would advise that you avoid those at all cost. It's important to have somebody come with you the day of surgery because you will be receiving general anesthesia. You'll be put to sleep, and the medication that you receive stays in your system for about 24 hours. So we advise you not to drive for 24 hours after surgery, so you're going to need a ride home. It's also important to have someone there with you who has not had any medication so that we can give them your discharge information, your discharge instructions, any prescriptions that Dr. Prasad would prescribe for you. When you come in for surgery, we need you to bring a photo ID, like your driver's license, and your insurance cards. Prior to surgery, you will have received by email or in the regular mail some financial documents as well, and we need you to bring those with you the morning of surgery.